We talked about Diabetes Awareness Month during this month of November. And unfortunately, when we used to talk about diabetes, it was strictly for older Americans, right? The population. You would get, quote, sugar, which would cause health problems. Now, unfortunately, we're seeing more and more diabetes conditions in our youthful population. Kind enough to join me this morning is Danielle Domingo. She is a registered dietitian with Akron Children's Hospital. And Danielle, unfortunately, a lot of this, when we talk about youth diabetes, comes back to our present day diets.
Exactly. Good morning. Yes, I'm a registered dietitian and certified diabetes educator here at Akron Children's, and we are seeing a growing number of kids between the ages of 2 and 18 being diagnosed with type 2 diabetes. Just in this last year, we have seen 1,689 referrals for elevated hemoglobin A1Cs. Which is actually, that's a 13% increase in abnormal A1Cs from 2020 to 2021.
Danielle, and when we talk about, there's obviously factors, but the food intake and the diet with so many people on the move and processed food and maybe not eating the right times or the right type of foods has a big role here. From your education, diabetes educator, and also a registered dietitian, talk to parents to maybe look at maybe making some adjustments within their menus.
Yes, the biggest things that I'm seeing day to day in these kids' lifestyles is we have significantly decreased physical activity as well as increased the added sugars in our diet. And so added sugars are just that. They're sugars that are added on top of the already existing, naturally occurring sugars in food. So fruit and milk are going to be your, naturally occurring sugars. So anything added on top of that is what's being consumed in excess.
I think it's important to note so parents can understand those labels as they try to make the adjustments when they see on the side sugars, sugar added, and what are the numbers they should try to stay in line with, Danielle?
So according to the American Heart Association and the American Academy of Pediatrics, it is recommended that children under 2 years of age actually do not consume any added sugar at all. It's recommended that kids between the ages of 2 and 18 keep the added sugars to less than 25 grams or 6 teaspoons a day.
Now, that's a significant change when you talk to most families, correct? With so much being camouflaged in the sugar area right now. But what does, when they read the label and it says sugars and then it says sugars added, educate all of us.
So added sugars can be a little sneaky. So the added sugars are going to be under the total sugars, which are both under the total carbohydrates. So those added sugars can go by many different names, or aliases, I like to say. So they can actually sound natural, but again, they are added into, they're added in addition. So that is just excess sugar. So they can come in names such as agave, corn sweetener, dextrose, juice concentrate, glucose, honey. So anything with the word sugar or syrup, brown rice syrup, you'll find those as added sugars.
Danielle Domingo is with us. She is a registered dietitian, diabetes educator with Akron Children's Hospital. Danielle, I know when people are heating up the processed foods, whether it be a pizza or French fries or one of those frozen dinners, there's a lot of sodium inside those type of meals. But are there sugars as well, and are those dangers for the diet?
There most definitely can be added sugars. I see that a lot, more so I would say in like canned products. So like our canned fruits are going to have added sugars. A lot of, more so I would say packaged. So like packaged baked goods, cereal bars, granola bars, cereals, fruit snacks, things like that are going to have a lot of the added sugars.
I urge you to read the labels. And the other thing too, and Danielle, I've had 4 kids to come through my kitchen, and the one thing I've noticed since I watched my sugar intake is the amount of sugars that are in the liquids. And again, when you go to the fruit juices aisle, there's a lot of sugars in these fruit juices.
Yes.
You really have to be leery. Take us down that aisle, Danielle.
So this is literally a low-hanging fruit, right, that we can get rid of and eliminate so much added sugars right there. So I always encourage my patients to eat their fruit instead of drink it, because there's going to be a lot of added sugars with those fruit juices, which again, so all of those teaspoons of sugar cause that blood sugar spike, right? And that's what we want to reduce. We want to try to avoid that. So we want to eliminate the fruit juices, even if it says 100% fruit juice. We want to try to eliminate that and any other sugar-sweetened beverages.
Danielle, let me ask you this. There's a lot of parents listening to us that are saying, I hear what you're saying, but I'm on the run. We got 2 parents working. I'm doing what I can to get the food on the table, and sometimes I do have to pop in a frozen dinner, or sometimes I have to do this. I'm doing the best I can. Or there might be a parent out there saying, you know what, my kid needs a little pickup with some sugar in the mornings, and they're little. I don't need to worry about that right now. As a diabetes educator and a registered dietitian, what do you say to those arguments?
I would say that we need to look at the bigger picture. We want to have complexity at the mealtime, but it doesn't have to be elaborate. I mean, we can go back to basics as simple as a protein and some sort of produce, so pairing our peas. So some sort of fruit or vegetable plus a protein, that's going to give us longer, more sustained energy throughout the morning to get us through, our morning classes and school and all of that. You want to have that protein present so that we prevent as high of a blood sugar spike. So an example of this, at the very minimum, giving our kids on the run a piece of fruit and a low-fat string cheese, or a peanut butter, some peanut butter and cut up apples.
I like what you had to say too, Danielle. That's certainly a lot what we've talked about is diet, but you also said a big way to fight diabetes is to get these kids moving. And for us parents, that's real important because, again, going back to what I said a couple of moments ago, right, Danielle, we're moving. There's a lot of busyness going on, but let's not just let them sit there on their electronics and pass the hours. Let's keep them moving.
Exactly. And even making it a game and saying, okay, well, we can earn more screen time with physical activity. So the more minutes of movement we get in, then maybe we can earn a little bit more screen time as well. But the recommendation is to limit screen time to less than 2 hours a day, which I'm seeing, most kids are getting, double if not triple that in a day.
I agree. Danielle, great visit. Thanks for the education and carving out some time for us on a Friday morning. Thank you very much.
Thank you.
All right. Danielle Domingo again, registered dietitian, diabetes educator at Akron Children's Hospital with us this morning.